Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei-Suji on the digital platforms of the Honolulu Star-Advertiser. This episode of Spotlight Hawaii is brought to you by Chaminade University.
Aloha, good morning. Happy Aloha Friday. Thank you so much for joining us here on Spotlight Hawaii. I'm Yanji Denise, joined by Ryan Kalei-Suji. Ryan, you and I both have ties to the leader of this next island because it's the place where we grew up.
That's right. We're looking forward to beginning this show with Hawaii Island Mayor Mitch Roth, who's joining us now from the Big Island. Good morning, Mayor. Thanks so much for being with us this morning.
Hello, guys. Good morning.
Let's start by talking about the case counts. Overall in the state, we saw a slight drop in case counts, but today 747 cases reported throughout the state, 63 for Hawaii County. But what are you seeing in terms of trends there on the Big Island?
As we watch these case counts, I've kind of stopped watching the numbers from the Department of Health because they're coming in with different numbers every day. So sometimes we'll have a delay of several days, and so we'll get a count of, we had like over 200, and then we have counts like the other day was 50, and then today another count. So we've really been trying to watch what's happening at the hospitals and make sure that our hospitals are able to take care of people, make sure that we're not having a lot of people dying. Those are kind of the things that we're looking at. I'm contacting the hospitals daily. They give me their reports, and I'm kind of gauging it from there.
Well, let's talk about those hospitalizations. A couple of weeks ago, we were able to speak with the leadership over at Hilo Medical Center, and they said they were right on the edge of their ICU filling up. Now we know that they have more patients, and so they've had to make some adjustments. What are you hearing from medical facilities throughout the island?
Each of them are a little bit in different situations. Hilo Medical, they have 11 licensed ICU beds. Today they have 19 ICU patients. So that is kind of alarming for us. But in talking to Dan Brinkman at Hilo Medical Center, they are still able to provide critical care. So that's important. And we're watching that. Over in Kona today, I believe they have 9 licensed beds. And as of this morning, they were at 8 of those being filled, so they had 1 open bed. And then in Waimea at North Hawaii, they had 4 beds, and all 4 of those were filled. And so we look at those things, trying to make sure that if people not only have COVID, if they have other incidences, that the hospitals are able to take care of them. Earlier this year, I had a heart attack, and I realize how important that first hour of time is if you have a heart attack, if you're in a car crash, if you have a stroke, if you're having an allergic reaction or some other kind of emergency. Those times are real critical. And when you start seeing the ICUs being filled up and overfilled and people having to wait in our emergency rooms, that means that critical care could be impacted, and the time it takes to get to see a doctor may take some time. And so we're watching those things very, very carefully to see what happens there.
When we hear those numbers, it's pretty alarming just how close it is to being filled at capacity, and really the numbers game that you're having to track every single day with those available beds. What is the backup plan? Say, should we get to a point where your island is not able to sustain the level of care and treatment that is necessary for COVID patients, or as you mentioned, those who suffer from a heart attack? What does that backup plan look like, knowing that the Oahu facilities are also experiencing, such a surge?
Right. So, each of the hospitals have their own plans. There's tents that have been set up. I don't think any of the tents have been utilized at this time on the Big Island. But we also have to watch what happens on Oahu and on Maui. When we have critical patients, oftentimes they're flown to Oahu because not all of our hospitals are able to handle those people. And a couple of weeks ago, for example, I was at North Hawaii, and they had some people there that they said really shouldn't be there. They need to be on Oahu, and good thing that they were able to bring them over there. But there are plans, and we keep on watching to see what's happening with those, what's happening with the tents, are they being utilized, and what's happening again in the ERs.
You've already limited gathering sizes. I believe Hawaii County has the strictest limits with just 10 indoors and 10 outside as well. Other than limiting gathering sizes to reduce the spread, what other tools do you have to limit the spread of the virus, given that you've already taken those measures?
Yeah, I'm sorry. I think we're freezing up a little bit. I heard about the limiting sizes.
Oh, well, let me try that again.
Sorry.
Well, what I was saying was that, Hawaii County already has the strictest limits in place with 10 indoors and 10 outdoors. What other tools do you have to hope to stop the spread of the virus?
I think the biggest tool that we all have is aloha, and bringing the community together, and the community taking responsibility. It's all of our kuleana to make sure that we have a safe and healthy community. It's, everybody in the community has a stake in this. You could have keiki, kupuna, friends, family. And, when we limited the gathering sizes and we enacted rules at our parks with no tents or canopies, what we saw was the community really taking this seriously. They came together, or more like it, they didn't come together, didn't group up this last weekend. And I see that's our biggest tool, is getting the entire community to realize that this is all of our responsibility.
We know that the other islands, such as Oahu and Maui, will be implementing a vaccine verification. You have decided not to go that route with requiring businesses and establishments, such as food establishments and restaurants of sort, to require that or a negative testing. Is that something that you are considering? And if not, why is Hawaii County opting not to participate in this when the other counties are?
So we are considering it. We're watching what happens on Oahu and Maui. But as we do our assessment right now, there's several things that we're looking at. One is, if we were to put those plans in place, we're a rural island. There's a lot of businesses that barely made it through last year when we had a whole bunch of safety nets. Right now, we don't have those safety nets. And when a business goes out of business, whether it's mom and pop store, that really affects the economy. It really affects people who have who are struggling to get by. We had a lot of people that were able to go to the food lines and get food. So there's things that we look at. One of the things in talking to the medical community is poverty is one of the greatest enemies of healthcare. And if we were to do that, part of the assessment that we're making is that there's a lot of people that may be put into a more desperate situation. I'm not against vaccination. I'm vaccinated. I have no problem with telling people that they should get vaccinated. But at this point, putting those mandates in, I think may more negatively affect us than positively. And again, we're trying to bring people together rather than tear people apart, because our biggest tool is aloha. And if we're working together, we're more likely to succeed than if we're fighting against each other.
Early on in the pandemic, Hawaii Island was very proactive in testing visitors who are coming to the county, requiring, of course, with safe travels, that inter-island folks, that was for all of the counties, have to be tested before arrival, and then doing post-arrival tests and secondary testing upon arrival. Do you have any plans to bring that back, or do you think that safe travels should be restricted again to require more testing before people can land in Hilo and in Kona?
Yeah, so that is something that is really a decision that gets to be made by the governor. But it is something that we have asked the governor to bring back, to not only test people who are non-vaccinated at this time, but people who are vaccinated coming to Hawaii. We've made that request. We've made the request to have post-testing, and we're looking at a plan where we're able to do that with maybe self-tests so people know. The other thing we've asked the governor is when people opt out of the Safe Travels program, which we still have, the only thing is if you're vaccinated this time, you don't have to test. But we do have people who have not been vaccinated, who refuse to test, that choose to be quarantined. And one of the things that we're asking is, let's let the media know who those people are who are choosing not to vaccinate, who are choosing not to test, and are claiming to quarantine, because oftentimes they don't. And it's very difficult for people to know. So, if the public is more aware that we're doing this, then it's more likely that people aren't going to take that choice. And if they do, we're able to better enforce those rules and laws.
Ryan, let me follow up on that. Oh, sorry, go ahead.
Yeah, just to clarify on that, you're asking when you say the media, so almost presenting a report, if you will, of those who have opted into the quarantine upon arrival, and using maybe a Citizens United campaign against, and to make sure and ensure that these individuals are actually quarantining.
Absolutely. We have a lot of people that are upset about people who aren't following the rules, and they will reach out to let the police know. They'll reach out to let their businesses know. I mean, if you're working in a place and someone is a potential threat, you're going to make a report about that. But if you don't know who those people are, it's very difficult to make those reports. We know, for example, that a lot of the cases that we're seeing, we're the enemy. And that's all of us. The people that aren't following the rules, that aren't looking out for each other. We've put a lot on the tourists. And yes, there probably are some tourists that are doing that, but it also allows us to go to the hotels and say, hey, look, you have some tourists that are choosing to quarantine. We expect you to hold them to that quarantine. If we're not letting them know, how can they do anything about it? And then the hotels have liability, so they have a stake in this as well.
Okay, I want to go a little deeper on that. So the idea would be that if you choose to self-quarantine for whatever reason, if you're not vaccinated, and we know that a lot of returning residents have taken this option who are not vaccinated. They go travel on the mainland, come back, say they're going to self-quarantine, and the state just doesn't have the resources to police all of those folks. So it is somewhat of an honor system. Is your proposal then putting that up, their names up on a website, or publishing them in the newspaper, providing them to news media outlets? How would this actually work?
Yes, yes, and yes. So, I mean, we could have a website where the media can go. In Hilo, the Hawaii Tribune Herald, we put out the names of everybody who's arrested. The paper puts those names out, arrested and charged. Those people, there's a section on the paper where they have their names. With this idea of allowing those names to be published someplace, and allow the media to have access to that, allow the public to have access to that, people will know. It's not HIPAA information, because we're not saying that you got vaccinated, you didn't get vaccinated. We're not saying that you have COVID, because you may not have COVID. We're saying that you've chosen not to follow the rules that we've had in place. And so you've chosen to take this alternative to be in quarantine. Now, and remember, this is different than isolation. People who are positive, they get put in isolation, where they're told to stay home for these health reasons. We're not talking about that. We're talking about people who are traveling to Hawaii, putting their names when they don't follow the rules that we have.
Yeah, I mean, I know that section of the Tribune Herald all too well. It's a section in the newspaper everyone in town looks at, but no one wants to be on. Expanding a little more on some of the things that are happening there on Hawaii Island, including the vaccination efforts. What is the county doing to step up in this area? We know that this is an area that lawmakers continue to push for, and getting people vaccinated. And in an island community like Hawaii Island with so many rural areas, how has the access to vaccines been made available for some of these remote communities, and what are you doing to maybe enhance that?
So both, there's been both vaccination and testing clinics. I think this week we have 20 vaccination and 20 testing opportunities on the island. And it's great. We just did a tour of all the hospitals from Ka'u to North Kohala. There seems to be a lot of opportunities to get vaccinated, through the hospital system or through the different testing clinics, because generally the testing clinics also have an opportunity to get vaccinated as well. And so we've been putting those out there. There's been several initiatives where people have received, money or prizes or things to get vaccinated. And we continue to support those efforts. And now with the mandates for either to be vaccinated or tested, there's a lot of people who have chosen to get vaccinated as well. And of course, unfortunately, because our numbers are high, we're seeing a lot of people sick, and because our hospital numbers have been really high and people have got really seriously ill, more people are having family members or friends or coworkers who have had really bad COVID experiences, and they don't want those experiences, and so they're choosing to get vaccinated.
Part of the push to encourage people to be vaccinated is this mandate from the governor that all state and county employees be vaccinated or be tested on a weekly basis. Oahu has gone sort of the strictest and done away with the testing option, except in those who have a verified religious or medical exemption. The other counties have not gone that far. Are you looking at that and possibly following in the footsteps of Mayor Blangiardi, or why have you chosen to go the other way?
Yeah, we are looking at that as with everything else, and again, we're really trying to bring our community together because we do believe that it's the feeling of aloha and working together as family and friends that's going to get us over the line and get people to be healthier. We have not said we're not going to do that though. If it seems to work really well in other counties, we're still leaving that option open.
I'm wondering if you can share with us a little more about what these meetings are like. We know that you meet with the mayors and the governors now on a regular basis to discuss these types of issues. And when you put up for different proposals to the governor for things that directly impact your island, how are these meetings managed essentially? Are you feeling that the needs are being heard on the statewide level? Are you discussing other options with other mayors and deciding on plans together, or is it something more that is coming down from the administration providing direction to the counties?
So we have a couple of different meetings. We have meetings where it's just the mayors, and then we have a couple of meetings a week where the governor and the mayors are on those meetings. And then there's another meeting that is just the governors and the mayor. So during Mondays and Fridays, we're generally in one of those meetings together. And what's great about the mayors is we all realize that we have different islands, different needs, and different abilities. Hawaii County is very large geographically. Kauai is very small. Honolulu has a lot more of everything other than land. And so we all realize that there's very significant differences. And so we're very respectful. It's a great group of people to talk to. For everything you see on the news, we're able to openly talk and put our ideas out there. And the state and the governor are also able to explain why and why not. And we have very lively discussions, but they're very, very respectful.
I want to follow up. You said that you had asked the governor to make some changes to safe travels. Are you talking broadly about people coming from outside of the state, or are you talking about making those adjustments to the safe travels program within inter-island travel?
So right now we're mostly talking about outside the state, although that conversation was also had about inter-island just yesterday. We had a meeting and it came up, and there's a lot to be considered with all of these things.
Yeah, what's your take on that? Do you think that they should bring back testing or more requirements for inter-island travel?
One of the things that we're looking at in that whole idea of testing, if we're going to do it the way we did, it takes a lot of people. And right now, probably our biggest problem with that is finding the people to do it. I mean, much like your hotel workers and your restaurant workers and every other job, everybody's trying to find employees. And then it's very expensive too. So funds are another issue. And then the impact on the airports.
We have, of course, questions of people asking about schools, and we wanted to get your take on what's happening there on Hawaii Island. We know that there are reported cases by the Department of Education in schools of COVID cases. How do you feel that overall these schools are managing COVID-19 on Hawaii Island? Do you think that it is a safe environment, and are you happy so far with the way that the DOE has implemented some of their guidelines?
It's interesting. I'll go back to the last question on the meeting with the mayors and answer this question. Prior to the schools opening this year, we asked them to put a kind of a pause on that because we had some real big concerns dealing with testing and what's going to happen with busing, nurses, and all sorts of things. They didn't put the pause on. We saw some of the issues that we were worried about. They continue to be there. But that being said, we meet with our CAS, our campus area supervisors, all three of them, every week. And I've been really impressed on the measures that the schools have been taking. They're doing the best they can with what they have. And at this point, if you were to put a pause on it, I think it may be more of a problem than not. I wish that I still wish that they put a pause on prior to get started, because that's when our numbers started going crazy, and we know that the schools are part of that. So with what they have, I think they've been really doing a pretty amazing job, but they need more to really help them out.
One of the things that made big news, of course, is Los Angeles becoming the school district, the largest school district, and I'm not sure if they're the only in the country right now, leading the way and mandating vaccines for those who are students who are 12 and older. That obviously is not your decision to make, but
Right.
What do you think of that kind of a decision? Is that something that you'd support?
Well, when I was growing up, I had to get vaccinated for all my shots, and I think that may be something that probably easier doing than doing it with the adults in our community. So I wouldn't be super against it, although I think we need to have all the science back from how it affects younger individuals.
When we are seeing just a division in community, we see it online, of course, with people commenting about this vaccination and this use of the vaccine for COVID-19 overall. We see protests that's happening on the island of Oahu, and I'm sure that some happen on your island as well. What do you take of this division that's happening in our community between those who are against requiring these vaccine mandates and vaccines as a whole, and those who are trying to push this idea of just trying to get vaccines out there in the community?
Boy, I'll tell you, there's a couple of thoughts that just come to my head. One is I think the science is pretty good when you have a whole bunch of really smart doctors, the CDC, who recommending vaccines. What we see in our hospitals, where almost every patient in the ICUs are unvaccinated, and almost every patient who's dying of COVID is unvaccinated. I think the science has kind of proved itself. It amazes me how many people get their news and their information from Facebook and some of the social media things. Um, it, you know, it just amazes me, and how divisive it has become. You know, again, I came to this job to help bring people together. We need to start unifying people rather than dividing them, though.
You know, Ryan brought up the issue of access to the vaccine because so much of Hawaii Island is so rural, but there's also, you know, other issues of people who are sort of holdouts for other reasons, not necessarily for lack of access, but just for lack of interest or wanting to resist. Have you identified demographics in the community? Who's not getting vaccinated right now, and what are you doing to reach those specific areas?
You know, we meet with epidemiologists. We meet with the state epidemiologists. Have a national group that also is giving us information that's running numbers, and it's generally the younger crowd. We see a lot of those people, usually younger men. And I know there's going to get controversy, but I think generally it's less educated than the more educated people. Although we have some people who are doctors that, you know, also are anti-vaxxers. So, but generally that's what we're seeing: younger males in between the ages of 20 and 35.
As we look forward, you know, and down the line, these numbers continue to remain pretty steady and pretty high overall. As much as these orders have gone into effect and these restrictions have been put into place, we haven't really seen that much of a difference, including, again, looking back at the numbers that we saw today with 747 throughout the state. And knowing that, I mean, when do you think that what would be, I guess, the benchmark for you, or the turning point where you deem that this is something that is now controlled? Would it be looking at the hospitalizations? Would it be just overall case counts? I mean, when would be that determining factor for you to once again open up some of these group sizes and restrictions that you put in place?
When we're not seeing people dying, and when we see our hospital being able to handle, you know, people safely. I mean, they're right now they can handle them. They can still handle crises, but they're at a crisis with our emergency rooms and our ICUs in particular, really packed. When I see those numbers come down significantly, I'd feel a little bit more comfortable taking away some of these measures.
We are almost out of time, but we want to give you an opportunity to share a final thought with the community as we head into the weekend. We know a lot of people, we see it in the comments, they really are on both sides. Some people saying that you really need to, you know, be more restrictive, and other people asking, when are you going to lift these restrictions? So just a final message for our audience today.
You know, tomorrow is the 20th anniversary of September 11th. We've had a lot to think about during that time, but it was a time where it kind of ripped us apart, but it's also a time that brought us together. Now is a time, as we think about, you know, September 11th, to come together as a community, as a state, to really do the right things. Whether you're vaccinated or not, you know, we all have responsibility here. We all have responsibility to not be in large social gatherings, to wear our masks, to socially distance. And, you know, if for those people who aren't vaccinated, we'd highly encourage them to get vaccinated, because those are the people that are really clogging up the hospitals that we're seeing, is that most of them are unvaccinated. So that's, you know, we'd ask you to be safe this weekend and every day. And just remember, we're all in this together.
Okay, Hawaii Island Mayor Mitch Roth, thank you so much for being with us today. We really do appreciate it.
All right. Thank you. Take care.
Aloha. Well, Ryan, very interesting to hear from the mayor there, and a new idea that I don't think I've heard any leader float in the past, and that is this idea of taking those folks who have elected to be in self-quarantine to then put those names out either on a website, or, you know, he mentioned that section of the Hawaii Tribune Herald where they put the arrest, just so that people in the community are aware of who in their community is supposed to be self-quarantining, and making sure that that's actually happening. Oh, and you're muted.
It's the first time that we've ever heard any public official make that statement, and an idea that you're right, we have not heard yet. We'll see what happens. Again, that is something that they are continuing to work through. We also talked about some of the things that are happening with Hawaii Island, specifically with the hospitals. And while the hospitals are seeing a surge and they are at a point where they are having their healthcare workers really overworked, right now there is still some facilities and some beds that are available for those critically ill patients and those needing that attention. And so the island right now is not at a point, a critical point, where they have to use some of those backup plans that they have prepared for, including tents that have been set up at some of the hospitals on the island. But right now, things seem to be holding given the numbers that they're seeing.
Yeah, but when he went district by district, he said all 4 beds in Waimea are full. 11 beds in Hilo are supposed to be available. They have actually 19 patients right now, and in Kona there was 1 bed left. So they are really at a breaking point and very close to it. He says that he actually doesn't watch the numbers day to day with as much closeness as he watches the actual hospitalizations. He thinks that that is a better metric to make decisions. As you mentioned, they're not using that spillover facilities, when it comes to tents just yet, but that is something he's looking at closely. Also interesting to hear that he does want perhaps more restrictions when it comes to travelers, particularly those coming from the mainland, that he's asked the governor rather, to reconsider some of those safe travel restrictions to try to tamp down anyone bringing virus back into the state.
But again, some of the issues with that is funding overall and just finding the resources and the personnel to ensure that those types of tests can happen and that they are fully staffed and adequately staffed for implementing those types of additional measures. Also hearing from the mayor saying that he is open to the vaccine verification that we're seeing on Maui and Oahu, but he has decided as of right now that the Big Island will not be implementing that, saying that it could cause further division within the community, and also that because of the rural communities and the smaller establishments that are set up on the Big Island, that some of the businesses may not be able to afford losing customers who choose not to be vaccinated or prove a negative test. And so the mayor says they will watch to see what the other counties are doing, watch their numbers, and make a determination if they need to head down that route. But as of right now, Hawaii Island will not be requiring that.
Yeah, always great to hear from the mayor there. And on Monday, we're going to be joined by another official who joins us on a regular basis. That, of course, is Governor David Ige. We always like to hear from him to kind of get a pulse on what he's thinking. Will he bring back some of those safe travel restrictions? What does he think of the idea of publishing those names in a public forum for those who have decided to self-quarantine? We know here on Oahu, they're dealing with far more, thousands who could be in that circumstance. It is an interesting idea. I don't know how many people will take to it, the idea of sort of neighbors watching neighbors, but absent police enforcement, it could be a way to figure out who actually is quarantining and who needs to be. So we'll ask that to the governor on Monday.
We got a lot of questions for him, and I'm sure many of our viewers also have a lot of questions for the governor. So we'll see you right back here on Monday at 10:30 with Governor Ige for another edition of Spotlight Hawaii. Until then, have a great weekend, stay safe, and aloha.
Aloha.
This episode of Spotlight Hawaii was brought to you by Chaminade University.